Hi everyone, welcome back to my channel. It's Shade Corriday, and in today's video we're going to be talking about my most recent appointment to the doctor. Can y'all see my hand movements? So I was feeling discomfort in my legs earlier this year, let's say like February, and I thought it's time to get checked out. So by the time I finally had a checkup, that was in April, so last month basically, and that appointment was just to talk with the doctor. Yes, that same doctor I talked about in my other video. I know, I still went back to him. Basically gave him my symptoms and we just decided what we need to do next. So the decision was to get an appointment called Sclerotherapy, which is ultrasound, I'm looking at my notes, ultrasound guided injections. I will also put that on the screen, but this is to treat veins that are not healthy, that are more towards the surface of the skin, so not as deep. So for those, you don't need to get the minimally invasive surgery for that. Quick note, sclerotherapy is considered to be a cosmetic procedure. So if someone does not have chronic venous insufficiency, but they do have varicose veins, they can use this for treatment. However, I chose to get this procedure, although not recommended. I chose to get this procedure because it helps me with my symptoms personally. Since it is cosmetic, it is not covered by insurance, and I did have to pay $225 for it out of my pocket. My appointment was on the 3rd of this month, which is May. So it was not fun. The doctor's basically looking for using an ultrasound tool to guide them to find veins that are not healthy, and then they inject the vein with medicine. Let me rewind. I woke up that morning and I was like, all right, appointment day, what do we have to do? So I got an email from them, from Vein Clinics of America, and they basically told me, hey, for this appointment we need you to hydrate and we need you to eat a light meal in preparation. So cool, did that, hydrated, made sure I drank tons of water. I can't remember how much I drank, but isn't this cute, by the way? I got from Marshalls. Don't remember how much I drank, but I think it might have been it was at least more than one bottle of water. So I get to my appointment, they check me in and they send me over to the room, take my vitals. After that, they sit you in a room and have you change into some smock shorts. I'll put them up on the screen. I'll put the video up on the screen. It's like a short video of the shorts that you have to wear, and they're like socks, shoes kind of. So I put that on, you keep your shirt on, and the doctor comes back in. So here's the scary part. So I told her I need a stress ball because me in pain, my pain tolerance is trash. So I told her can I please have a stress ball? And she didn't have one, but she gave me something to use in place of it. So I did have something. So the first thing she did was to explain to me what she was going to do. So they actually recently changed this procedure, because the first time I did it, I actually did one leg at a time. So I did one leg. One day I did one leg, and then I came back a couple weeks later to do the second leg. This appointment, I did both of my legs, which I probably will never do this again. But I did both of my legs, and she explained to me that the new procedure is that she has 15 minutes to basically find as many unhealthy veins as possible and then inject them. What is that game called? When you go into the house or you go into a room? Escape room. I felt like my legs were the escape room, because she's basically going on a scavenger hunt for unhealthy veins to treat, and she has 15 minutes to do it. We started with my right leg, and I basically laid down on the little patient bed. So I first laid down on my back, and she did my right leg. So she cleaned it with alcohol, and she used her ultrasound guided tool to basically, it felt like a circle tool. I never saw it, but I just felt her moving it across my skin, and then she'll stop, and then she'll inject, and then she'll move it, and then she'll stop and then inject. It was literally stop and go. That's how the procedure felt from a patient's perspective. So the needles are very short needles, and it's almost like getting your finger pricked for blood. So it's like a quick prick, but depending on what part of my leg she was pricking, the pain was different. Sometimes it felt like she was going deeper in some places, but it might have been because I have less flesh or more flesh in that area of my leg. Like towards the knee obviously was a different experience than it was like behind the knee, than it was on my calf, and obviously than it was on my ankle. She even went a little bit into my lower thigh area to give me some injections. So she repeated this process basically when I was laying on my front, so basically to get my back leg, and then I laid on my back so she can get my front, and then I did turn my leg to the side so she can get the sides. It was just like I was literally in my head coaching myself, like, Shadi, you got this, it's just a prick, like you can do this, like it's just a little prick, you got this, it's nothing. Like I was coaching myself because I don't know about anybody else's pain tolerance, but mine again is trash can. So I was like trying to build myself up to have the courage to sit through that. She did check on me and, you know, make sure that I was feeling, you know, comfortable and okay. And, you know, I told her like, I'm okay. And I just kind of wanted to just get through it. When she got to the left leg, she repeated the same steps. She did point out that she noticed that I have more unhealthy veins in the back of my leg than I do towards the front and the sides. So I did take note of that. And I do have a theory that the way I stand makes me put more pressure in my legs in a certain way, but that's just a theory of mine. So we did my second leg, and by the time she was done with that, 15 minutes was up, and I felt like I was in pain. Like the injection sites, I had a whole, she must have injected me. I didn't count. I wanted to count. I went in there like, I'm gonna count how many injections. By the time she did like 7, I was just trying to get through. But if I had to put a number to it, I might have gotten about 30 injections per leg. So that lets you know how many bad or unhealthy veins she found. I basically had like what looked like mosquito bites that were a little swollen all over my legs. And they hurt and they itched and they were a little uncomfortable. So that was the feeling that I had. And yeah, that was basically my appointment during. So then of course I changed, put my clothes back on, and I was out the door. The last time I did this appointment where I did like one leg at a time that I described before, that appointment, I think I felt heaviness and discomfort from the appointment, maybe like the rest of that day, and the next day I was fine. This time was very different, and I don't know if it's because I had more veins that were bad or because I did both legs. After my appointment, I actually went to the grocery store straight after, because in my mind I was still operating like, oh, the last time I did this I was able to, you know, still move around. That was a mistake. If I can do it all over again, I would have worn my compression stockings, which I will make a whole nother video about. For this appointment, yeah, I did not bring them. And I also wasn't told to bring them. So I'm not really sure if it's a requirement, but after this appointment, after that day of walking around without them, it was really bad. Like I went to the grocery store and I was holding on to that cart for dear life. And I badly needed to like get a couple things. So I went over to Trader Joe's and got some things, but I was struggling. My recommendation, if you're doing this procedure in both legs, that you might want to bring your socks. Wear some compression socks and stockings to put on after the appointment and keep them on. So after that day of realizing that, wow, like this is not the same experience, the next day, which was the 4th of May, up until today, which is I'm looking at my calendar over there, which is the 19th of May, I've been wearing them every single day. And I've been wearing my socks, alternating between my socks and my stockings, depending on what I'm wearing. It kind of sucks because it's warmer outside now, but I'm making it work. I'm doing what I have to do. I was in what I would call pain or aching or throbbiness or soreness of my legs from this procedure for about a week. And that was not my experience last time, so it was very interesting. Yeah, so for about a week, it was a struggle. But today I'm feeling better. Like it gradually felt better after that week. So now I'm good, but I'm still wearing them because I still can kind of feel a little bit of struggle. So I'm gonna keep wearing them and see what that does for me. And I actually do think I want to start wearing them more regularly anyway, because they are supposed to be for prevention. And I think that the mistake I've probably made in the past is I get these procedures done, I feel better, I live my life, I live my best life, you know, and I don't think about them until like I'm in pain again. I want to know, like, has anyone else done the these names, I need them to shorten them. I need them to like make them easier. Have any of you done this appointment? And those who have, did you do it in one leg? Did you do it in both legs? Was it 15 minutes or was it, you know, they had all the time? That cart was rude. Yeah. Anyway, so yeah, I want to know what your experience was like. Was it like mine? Am I crazy? Is this regular? Am I being extra? Like, what was your experience like? Please let me know down in the comments below. Please let me know what other type of videos you're interested in me making. Do you want to know about my other appointments? Let me know in the comments. But I do have on the screen the videos that are to come because I think these are going to be so fun. Whatever day of the week that you may be watching this, have a great day, and thank you so much for watching.